Hi everyone. This is probably the last video in the appendix series, and we know that appendicitis require treatment, that is appendicectomy. And what will you do if you find a lump when you examine the patient and you're planning that he or she may require surgery, but you find a lump? So for that we follow a particular regime that is called as Ochsner-Sherren regime. The question is why it is followed and what is that? So it is followed because if you think that the patient should be operated, it will be dangerous to operate the patient because everything will be clumped like small bowel, the omentum. Also, it is considered that the inflammatory process is already localized, so patient will not probably develop peritonitis. And if you operate in this patient, the appendix will be very difficult to find out. And if you somehow successfully complete the surgery, there will be serosal tears, there will be injuries, and the patient will have highly likely of having a fistula formation, that is fecal fistula. So this is important regime, and we'll learn what is this. So in this, the patient is admitted, kept nil per orally or very minimal diet as per the hunger of the patient. You will give IV fluid supplementation to the patient and also electrolyte correction if it is deranged, and you have to monitor the vitals of the patient. Also, in addition to that, antibiotics should be administered. So what are the components of Ochsner-Sherren regime? You have to mark the lump and keep on measuring the size, whether it is increasing or decreasing. You have to start the antibiotic therapy. You have to take temperature every 4 hourly or 6 hourly, and you have to maintain the fluid balance of the patient. And if there is clinical deterioration, the patient should be explored, that is laparotomy should be done. Usually the improvement occurs within 24 to 48 hours. If it is not there, then you have to stop the regime and plan for a surgery or some intervention. Okay, so if the lump is not resolving, you should suspect a carcinoma, or Crohn's disease can also be the findings. Now, what are the endpoints of stopping the regime? So if the pulse is rising, that is patient is not improving. If the pain is increasing, the abdominal pain, and if the size of the lump or the mass is increasing or the lump has disappeared, obviously, then you have to stop it. Thank you so much.